Hello everyone. So here in Kentucky we're having problems with the pensions and retirement plans. So this brings me up to the idea of Social Security income and SSDI. So if you're interested in either one of those, stand by and I'll be right back. Welcome back. So today's topic is SSDI and SSI. Do you know the difference? They are but they are also very different in very many ways. SSDI was actually formed in 1960, and that enabled employees, employers, self-employed to build this fund and withdraw from it. So let's get to the facts. First, SSI, Supplemental Security Insurance. SSI is a means-tested program designed to meet the basic needs of elderly, blind, and disabled individuals who would otherwise have a hard time paying for food and shelter. Because SSI is narrowly tailored for those particular set of people, it has a very strict set of financial requirements, making it what is known as a means-tested benefit. Now, what is considered to go into the means-tested is not only the financial requirements, but it is also what you own. Your vehicle, your home, money in accounts. So they also look at that and can deny you for those reasons. So Social Security Disability Insurance. SSDI is an entitlement program. And what I mean by entitlement program is workers, employers, self-employed have all paid into this insurance to cover us if we become disabled. So, SSDI is typically available to any person who has paid into the Social Security system for at least 10 years. Regardless of his current income and assets have to meet different requirements. In theory, all qualified workers are potential SSD recipients, even high-income earners. Now, it says potential recipients. You have to have the required credits. I think it's 40, and so they go back actually 5 years, I think. I don't think it goes back that far that they actually look at it, but yeah, it depends on how long in a particular time span did you work and did you have enough work credits. And it's all based on that work credits. So SSI beneficiaries typically receive Medicaid. One who receives SSI immediately qualifies for Medicaid benefits. Because Medicaid is a joint state and federal health care program that typically provides very comprehensive coverage for its beneficiaries, many people may apply for SSI primarily because of the health care that comes with it. Medicaid coverage differs from state to state in all states. Medicaid pays for basic home health care and medical equipment. Medicaid may pay for homemaker, personal care, and other services that are not covered by Medicare. There are Medicaid programs that pay some or all of Medicare's premiums and also pay deductibles and co-insurance for certain people who qualify for Medicare and need financial assistance. And there is a big difference. Medicaid is free. You don't pay anything for Medicaid. There's no monthly fee you pay to keep that insurance. There's no co-pays. There's no deductibles. And then they talk about Medicare. Medicare is something that you get if you have SSDI, not SSI, but SSDI. And you have to wait 2 years to get it. And it doesn't cover everything. You still need a supplemental insurance. And so Medicaid is free. Everything gets paid through it. And if you have primary insurance first, that's great. It's less that Medicaid has to pay. SSDI provides access to Medicare. SSDI beneficiaries are eligible to receive Medicare 2 years after they are deemed eligible for SSDI benefits. Medicare is a federal health insurance program that covers routine hospital services and most but not all primary medical care. Medicare is not as comprehensive as Medicaid. Now, let's reiterate on that. Medicare is not as comprehensive as Medicaid. And many Medicare beneficiaries purchase what are known as private Medigap policies to fill in the holes in their primary Medicare coverage. So, no. Like I've been saying all along, they're very much different. The financial benefits can be very rewarding. SSI and SSDI benefits vary widely when it comes to the amount of money provided. The federal SSI payment standard is $733 per month for an individual, while the average SSDI payment is $1,165 a month, since SSDI is based on the beneficiary's earnings record. Some SSDI recipients can receive much more than this. Social Security disability insurance is different. SSDI is an earned benefit that focuses on physical and mental impairments that are severe enough to prevent people from engaging in their normal occupations or other work. Their impairment must be expected to last for at least 12 months or to end in death. So, there are many diseases, impairments that are on the SSA.gov, and you want to go check it out. It's www.ssa.com. No, .gov, I'm sorry. SSA.gov. And if you haven't already, I would suggest that you go there and make up your own account. Everybody will have one. You got your own Social Security number, you'll have one. And sign up. And it will tell you how much you've made since you started working. As long as it's been in a check that has had taxes taken out of it. And it will, and then it'll give you a projection of if you had to go on disability right now, how much you get paid. It's a pretty nice tool. And anyways, yes, Crohn's, gastroparesis, all this other shit that's going on with me can end my life very quickly. So I have been deemed completely disabled. and not only by Social Security, but also by another company that's paying me long-term disability. And so SSDI benefits can be paid to blind or disabled workers, and like Social Security retirement benefits to their children, to their widows or widowers. Supplemental security income. SSI pays benefits to low-income people who are 65 or older, to adults who are disabled based on the same definition used by SSDI, or blind, and to children who are disabled and blind. The program is only for people who have very limited income and assets. SSI is financed by general revenues that the Treasury Department collects to run the U.S. government. And that's the big one. SSDI is paid out to disabled workers because we paid into the SSDI fund. But because you didn't pay into the fund, you're getting paid by American people. By general revenues, the Treasury Department collects to run the U.S. government. So SSDI is funded by the Social Security taxes paid by workers, employers, and self-employed people. SSDI dates to 1960, when Social Security's rules were amended to permit payments of benefits to disabled workers of any age and to their dependents. These benefits were based on the person's work record, as are retirement benefits. Once approved for SSDI, you wait 6 months for payment and 2 years for insurance. You also paid into, while you were working, Medicare. You pay into Medicare. Anyone who is approved for SSDI and is approved are entitled to Social Security disability insurance. When you work, you earn work credits and you pay into FICA. You are paying into SSDI. Yes, it is an entitlement. And no, SSI is not. So, anyway, those are the differences. And so many people want to sit and they want to argue with people over the differences between SSI and SSDI. And there is a difference. There's a difference between Medicare and Medicaid. But you do have people that will still want to argue with you. And even though you and I both can go looking all over YouTube for the differences, Twitter or YouTube that they're stalking to find the information. And then they'll still call you a liar. So who cares? But, you know what? Maybe I've taught somebody else the difference. Because it is confusing. And, you know, my main gripe is that I paid into Medicare while I was working. And why am I paying? Well, I'm not paying because I have good insurance. But I did take the free hospital insurance. And why not? It was free. I paid into it and might as well get it as Part A. But that's all it pays. It just pays hospital. And like I said, we'll never know, just in case something. You never know when something might not get paid. So I took it out. And I don't pay for it. But, you know, we paid into Medicare why do we still have to pay for Medicare? Why isn't it free? And why do other people get Medicaid for free and taken away out from underneath? It's from the funding of the U.S. government, which is money out of our pockets. I mean, you know, a person can live off of, you know, their Social Security. And they can live off, they got 3 incomes coming in. They can live off of it. I promise you, you can. I mean, I have. I mean, yes, it's very, very hard. And living here in Louisville costs a lot more than it does a whole lot of other places. And, you know, or like even around here, you know, you can, low-income people can get a very nice Section 8 home that is just for elderly and handicapped, and they're very nice, and they're on TARC 3, they're on, what's that new one, 7s, or something like that. I don't use Yellow Cab anymore. I use Uber. Uber has Uber Assist. No. I really like Uber. And then we have Lyft. I mean, these are things that are all over the place. I know Yellow Cab has handicap. And I know that Uber around everywhere. So I've looked. So, you know, if somebody really tried hard enough, they could save their money and get out on their own. Unless they don't want to get out on their own, and that's on their own fault. I mean, you can't make somebody get out on their own. My son moved out and is making $9 an hour and has a roommate, and they got a little house and splitting the bills. He works at Dairy Queen and had to get a new car because he told his, I didn't buy it for him. He bought it himself. We just got on the A-plan. So, anyway, life is hard. Just gotta learn to deal with it and get over it and live one day at a time. Well, folks, I'm done. I'm tired. Now I got to edit. And I do have resources, like I always do. And I'll also put down the you know, I'm thinking hard. Also put down the Social Security's website. And I hope you guys have a